patient is Noosh. Here she comes. Come and join us, Noosh. Tell us what your problem is.
It's hair loss.
Hair loss?
Yes.
Right.
So, caused by anxiety and stress.
And where are you losing it from?
It's on top of my ear.
Yeah.
And at the back of my head.
Caused by anxiety?
Yeah.
So can you just show the doctors where they are? Yeah. Right over there. So, Dirk, you can see that. I mean, this is...
We shouldn't forget it's estimated that up to 6 million women in Britain suffer of hair loss.
6 million?
Quite
That's 10%
common.
of the population, isn't it? Yeah.
Yes, and it's definitely always an underlying health issue, so that has to be found to get the right diagnosis, to get the right treatment. And I agree with you.
I just ask Anita, though, is it generally stress that's causing
stress can be a trigger, but sometimes, as Dirk rightly said, there can be things like thyroid conditions, it can be a side effect of medication, it can be signs of your body attacking your hair follicles, which we call alopecia areata.
Yeah. That's why it's very different, very, very serious. If a patient comes to my office, I would always send her to a specialist. In this case, they're dermatologist specialists who really just
find the cause of it.
Exactly, they will find the cause, and if in the end they really come to the result that the only way to help her is a hair transplantation, then she would be sent back to me.
So let me just ask Noosh, have you done anything about it? Have you found out what it's caused by, other than your own feelings it's stress?
Well, it would be a thyroid condition.
Right.
Yeah, so that's owing to it,
So
taking medication.
Definitely, I wouldn't do a transplant on her. She definitely has to work on this problem, the hypothyroidism she's suffering from, and so she wouldn't be a candidate, but for everybody else...
what you might call ordinary hair loss.
Exactly.
I mean, you know, the Wayne Rooney type of just receding, that kind of thing.
Like the male pattern hair loss, and women have the same. And in this case, I would take, the most common procedure is taking a strip of skin from the back of your scalp. It leaves a scar, which she can hide very well with long hair, and then dissect in tiny little pieces of skin with hair follicles, and then they're transplanted exactly in the bald patterns.
What sort of money does this cost if you want to have that kind of transplant?
That's what I want. I hope you ask me today, because I know you love to ask me how much
well,
it is. I give you a price today you can live with.
Yeah.
Hair transplantation costs £5.
£5?
Per graft. Up to 1,000 or even more grafts, so you can calculate at home how much it's going to be.
Oh, my goodness me. Right, we have... we get problems here all the time, don't we? Thanks very much indeed to Noosh. Thank you very much indeed. Thank you. Whatever you do, remember, plastic surgery is a last resort. Always seek advice from your GP before making any life-altering decisions. Don't forget, if you have a medical question, email us at alan@itv.com, and our doctors will be back next Wednesday to help answer them. My thanks to Dr Anita, to Lucy, and to Dr Dirk Kremer. Thank you very much for doing that.